This question states, a patient presents with a wound that is swollen, warm to the touch, and has yellowish discharge. This is most indicative of. And the reason that this is important to know as a medical assistant is because if you note a patient has this, or maybe on the phone they report to you that they have this, and they're not sure if they should see the provider, this is definitely something that you should bring to the attention of the provider working with the patient. And that's because, looking at choice A, wound infection, this sounds a lot like a wound infection, because if we see here the yellowish discharge, that sounds like pus. That's something that happens during an infection. It's swollen and it's warm to the touch. And swelling is part of an inflammatory process that is part of a wound stage. So we could go with option A now, but let's look at the other choices to understand these wound stages. So option B says a wound in the proliferation stage. So after it goes through this inflammation, as we see what's going on here with the swelling and the discharge, then we get eventually to the proliferation phase here. And during proliferation phase, new tissue starts to grow as the body works to repair this wound. So we can eliminate option B because we're not there yet, but hopefully this patient can get there soon. Option C is healing wound, and these phases, proliferation phase, and as we will discuss here, the maturation phase, these are both types of healing. So essentially, C is the same as B and D, so we can eliminate that as well. And then option D, the maturation phase, that's when the body starts to finally heal and scar tissue forms. It kind of stays at the surface level, so it's not a wound that's going deep into the skin anymore. So this also is a healing phase, so we can eliminate that. That will come later. And this indeed does sound like a wound infection. And just a reminder, as a medical assistant, you would not be diagnosing anything. However, it's important to note in the back of your head what this could mean for the patient and that you should alert the provider.